Well, good morning. I hope you all doing great this morning and you got some nice rest. And I got to thinking about something last night that I think it might be helpful for maybe a lot of you people out there. I don't know. But thinking about the environment, the pollution and all this stuff and all the lung problems that people have. And, and I'm one of them. I have severe asthma. That's why you'll hear me cough. And it gets pretty bad sometimes. And on top of that, I have syncope, which makes you pass out. It's some kind of where your blood pressure drops, or something that runs up to your brain, and it closes the blood flow and drops the oxygen to your brain or whatever. I don't know, something of that nature. And there's no cure for it. And then recently I found out that I have asbestosis and silicosis. So these are things that just started out, I didn't know anything about them. Excuse me. And about several years ago, and probably 15 years ago, and I noticed that these are things that if it's happening to you now, it's something you might want to go get checked out. But it started out just where I couldn't breathe, and I couldn't get any. It was like I could breathe, but I couldn't breathe out. I couldn't get the air in or something. It was just, I don't know what was going on. I'd be out working in the yard, and so I thought, okay, well maybe I better go get this checked. So I went to the pulmonologist, and they said, "Oh, you have asthma." Okay, wow, where'd that come from? But anyway, I'm an ex-smoker. I quit many years ago, but just smoking in general is damaging to your lungs. Just a little insight there. And so years went on, and it got worse, and they increased my medication. Now I'm on I carry albuterol with me in my pocket, and emergency inhaler is what it is. And then I have a breathing treatment machine. I forget what they call that thing. I use it almost daily. That's how things, they give you at the hospital. You get an emergency room or something if you have an asthma attack, whatever. You blow and you just suck on this thing, it's like steam coming out. Anyway, and 2 maintenance inhalers. One I do twice a day, and one I do once in the morning. So I'm kind of, have a leash with those things that I'll never be able to shake. And then recently I found out from a CT scan that I have the asbestosis and the silicosis, which just adds to the problem. And this is it can be complicated. It's not real bad. It's mild, but it doesn't go away, and it doesn't get any better. It actually gets worse as time goes on. And I need to go to a pulmonologist that has experience of interstitial lung diseases. I have one, but it says he treats it, but he's a young guy, young. I mean, I don't trust him. I'm gonna find somebody that's got a lot of background in it, and there's a lot more experienced eaters and stuff, and so I want to find somebody else. And he just seems to me, what I say is golden, and I know what he will probably just blow it off, so I don't trust him. And these are things that you want to look for. Chronic coughing just doesn't go away. You blame it on spraying. Oh, it's spraying, it's pollen, it's it's allergies. No. I do this all year round, and no, springtime it gets really bad, but I still have my coughing spells, and I pass out. And, I've probably passed out probably 4 times in the past week, and it just comes on just very quickly. You don't know when it's going to happen. I could just be sitting here, and all of a sudden I'll just cough a little bit, and then it just goes in and just progresses, and then next thing you know, I may just do a real hard quick cough, and then I'm out. And there's times that I'll cough kind of normal, and then it'll progress slowly, and then it just gets worse to the point where I'm gone, and I'll be out for 5 or 10 seconds. Not a good thing to have, especially driving, because you don't know what's going to happen. So driving is a problem. So I shouldn't really be driving, and I don't. Most of the time, if I feel good that day, I might run to the store or something. But probably technically or medically, or however you want to call it, I probably shouldn't be. And I need it's in my records, my medical records. I passed out in front of my doctor, my primary doctor at the VA, my cardiologist, and my pulmonologist. And so they can't say that doesn't happen. They said it's not common to have that. But so trying to think of other things you might want to look for. There's days that you'll feel good, and then there's days that you can just tell you feel real tight chested, and I'll wake up in the morning feeling very labored and breathing. I take off my mask. I have sleep apnea. If I start coughing, I can put my sleep apnea, my mask on, and I'll quit. And as soon as I take it off, and if it's a bad day, then I'll eventually start coughing again. So, and that's just forced air. I'm thinking I might be getting to the point, excuse me, that I might have to get oxygen therapy. I don't know, but right now I feel very labored in my just breathing, getting air. But let's see, anything else I could think of that would be helpful to you? All I can tell you is don't play around with this stuff, man. It could be asthma, it could be interstitial lung diseases. Is you can get that stuff from anywhere. If you work in a factory and there's a lot of dust and stuff in the air. I was a steel worker, and I worked in a cinder plant, and I was a labor gang and stuff like that. All these places were horrible. And back in the 70s, they didn't give you respirators. They're more worried about you getting cut, working around, coils of steel. So you had to wear these leather gloves with staples in them, and the wristlets with staples in them. Went all the way up to your elbow. But they didn't give you anything for protect your lungs. And OSHA was around. They never said anything. But yeah, this, any kind of around, if you paint or if you sandblast or anything, this stuff, and then they call it idiopathic lung disease. So what, it's idiopathic fibrosis, pulmonary fibrosis, and that means that you have it, but they don't know how you got it or why you got it. And so, yeah, I worked in the steel plant. I was in the Army 8 years, and I was a mechanic. And they said I could have got it there because that's one of the jobs that have that problem. So, but is it what caused it? But who knows? It's So, if you've done anything like that, you might want to get checked. And if you're having any breathing issues or feeling something in your lungs, or whatever, get it checked. It's worth it, Just they'll do a CT scan, and I would take the CT scan to an expert that knows about interstitial lung diseases and have them check it. I don't trust radiologists, yeah, because they work in in a fast environment. They got to get somebody out, and and they don't look all that great, all that good. I have multiple. I just found out from this last CT scan. I've had multiple CT scans. It was there, and nobody said a word to me about it. And even, there were some that didn't show it, and then the next one I'd have, it'd be there. So it's like some people see it, some people wouldn't. So you can't. I just don't trust radiologists. But I'm not saying that you don't have your good ones and whatever, but it's the environment they're in. Really fast paced, so they just kind of look for real obvious masses and stuff like that. They don't pay attention, I don't think, to the small areas that should be focused. You should focus on as well. You should look at everything, But I'm not saying anything bad about radiologists. I just, they have a tough job, and I just prefer to have somebody that can sit down, look at it real good, has years of experience, and knows about these types of diseases, and have them check it. Just, what I'd like to know is why my doctors, it was in my report, it said what it was. I had to investigate and look and see what these things meant, the medical terminologies. And then more I look, I was like, holy crap, man, why didn't they tell me about this? Not a word. And believe me, I let my doctors know. So you know what? If there's something in my report, you better tell me about it. I don't care how minor it is. You better tell me about it. This is ridiculous. And they stood there and looked at me. You could hear the crickets in the background. It was like, I said, do we have an agreement here? And they said, yes, sir. So, but anyways, I just wanted to let you know, and I hope it's helpful, and I hope you take this stuff serious, because, if you may go, I hope, I pray that none of you do, but if you ever have some lung issues, you go get checked, but they don't see anything really advanced, So I just wish the best for y'all, and hope my information was helpful. And don't be afraid to comment below and and ask me some questions, or tell me about yourself or something. If you're going through the same thing, I look at the comments. And so anyways, y'all have a blessed day, and give me a thumbs up, man. Help me out a little bit here. So I know that there's people actually out there looking at it and are interested in it. And subscribe if you want. I can tell you some stuff. But y'all have a blessed day. You take care. See ya.